Welcome to Liberia Rise. Let us know, give us a feedback here so we can definitely correct that as we go. But this is Liberation Rise, and today I have a special guest joining me from Monrovia, Liberia, and we are going to do our very best to get the program going, to get the program underway. But one of the topics that we are going to be discussing today is a recent report that just came out on the increased HIV cases in Liberia, individuals living with HIV in Liberia. And we just want to talk to people on the ground. We want to talk to individuals who have the first-hand report, people who will be able to steer us in the right direction. And that is what this is going to be all about. So as always, we ask you to please share the broadcast, share the show. And if you have any comments, let your comments come in. You'll be joining us through Facebook and YouTube. Send us your comments, and we will make sure our guests will be able to answer your question as we go. Our special guest today, though, is Mr. Solomon C. Hinneh. Mr. Hinneh is the executive director for NAC, which is the National AIDS Commission in Liberia. He has been with the organization since 2014, and he started in different capacity as a partnership coordinator, and then later he became the managing director for program and policy, and now he's the executive director. So basically, though, we want to hear from him. This is not this is not a Senate confirmation hearing. This is not where we bring him to say, look, you're in the hot seat, you have to answer question. Basically, this is just informational. And to our viewers, we ask that you please be respectful to our guest. And as he tried to answer this question, he does not have all of the answers, but he will give what he is able to give us as we continue the broadcast today. So, Mr. Hinneh, how you doing today? Can you hear me? We will get, and I'm so sorry, friends. We are having some technical problem here, but we'll get this underway as quickly as possible. Let me go here. All right, there we are. Can you hear me now?
Yes, I can.
All right. So sorry about that. Okay. To our viewers, again, we say sorry. Welcome to the broadcast. And if you didn't hear the introduction, our special guest today is Mr. Solomon C. Hinneh. And Mr. Hinneh is joining us from Monrovia, Liberia. He is the executive director for NAC, that is the National AIDS Commission in Monrovia. And as I was saying earlier, he has been with the organization since 2014. And Mr. Hinneh may not have all the answer. I don't want to pull, as I was saying in a joking form, this is now a Senate confirmation hearing. It's not come and answer all the questions. Basically, we just want to hear from someone on the ground, the news that we have heard, what is true and what is not true. And so we just want to talk to someone who is on the ground who will be able to give us some information. And to our viewers, those of you joining us in Monrovia, you'll be joining us on YouTube and Facebook. Share the broadcast, and maybe the information shared here today may not be for you, but it might be for someone else who might benefit from today's broadcast. So, Mr. Hinneh, I think did my best to introduce you, but say something about yourself before we get the show underway, please.
Well, as you said, my name is Solomon C. Hinneh. I work for the National AIDS Commission. Like you mentioned, I started out at the commission in 2014 and then up until now. So in my current role, I started as executive director in 2018 up until present. So basically, that's enough for the program. So when I joined the commission, I started, like you said, as a partnership coordinator. I then went on to become the program and policy coordinator, and then program manager, and then executive director. So that's where we are.
Wow. Okay. Well, so you must be doing something good for you to keep moving up the ladder, right? You're doing something. You're doing something good with the organization because I look at it the way I have to look at it. Sometimes people see what you're doing and they say, "Look, this particular brother have proven himself. Let's move into the next level." And so, but I am happy for having you on the broadcast today. And I just want to get straight to just tell me a little bit about your organization. What does the NAC do? And I may be completely naive, but I have never heard about the NAC until recently. So yeah, what does the NAC
Wow.
do? What is the role of the NAC?
Okay, so let's start from the beginning. So the National AIDS Commission was established in 2010 through an
Okay.
act of the National Legislature. Yes, in 2010. So the commission establishment came about as a result of the UNA's recommendation. From the way it started, there was a conference held somewhere in 2003, and then there were issues because when the AIDS epidemic first started, the response to that was basically health. So you have people waiting for people to get sick, taken to the hospital, and then before they are treated. So when the conference was held, there was this suggestion that the health response was not enough because you have other issues. If HIV and AIDS is more than a health issue, all right, it has to do with development, it has to do with social, it has to do with economic. So then it was decided that there is a need for an independent body apart from the Ministry of Health that will be
Hmm.
given the mandate to work in multi-sector. All right. So the UN is called this the three ones principle. So the first one is every country should have an independent body, one coordinating authority responsible to coordinate all sectors when it comes to HIV and AIDS in that country. Second is all countries should be guided by one strategic framework, that is the NSP, the strategic plan. And also, all countries should, the intervention should be monitored by one monitoring evaluation plan system. So, as a result of that, from what we understand, Madam Seri was approached by the United Nations to establish this group. And that's how the AIDS Commission started in 2010 to coordinate the decentralized HIV response of Liberia, multi-sector decentralized HIV response of Liberia. So that's how the commission came into being. So the National AIDS Commission mainly was established to coordinate and manage the HIV and AIDS response of Liberia. Some of the function of the commission is policy, develop
Hmm.
guidelines, resource mobilization and allocation, advocacy, create strategic linkages between local and international partners. The commission is also responsible to advise the government on all issues relating to HIV and AIDS in the country. So the National AIDS Commission comprises of what we call mandates. There are four main mandates areas. So you have five commissioners appointed by the president with the consent of the Senate, and each of those commissioners, excluding the chairperson, is heading a mandate. So you have the program and policy mandate. So the program and policy mandate is headed by the vice chair, and that mandate is responsible to coordinate all program-related activity in the commission. And then you have the partnership mandate. The partnership mandate core function is to create and strengthen partnerships with civil society, government agencies, and all of that. Then you have the decentralization mandate. That money is responsible to take the HIV response from Monrovia to the 15 counties.
Oh wow.
Yes. Then you have the strategic information management mandate that's responsible for MAE, studies, research, and all of that. So the day-to-day operations and administrative arm of the commission is run by the secretariat that is headed by the executive director. So that's the structure of the commission. Currently, the
Wow.
commission is in 6 counties: Mosoralo, Margibi, Grand Bassa, Bomi, Bon, and Nima counties. That's where we are. So just a brief overview of the National AIDS Commission.
Wow. So yeah, so since 2010, so basically I am one of those individuals who is probably behind. But then again, I'm not surprised because sometimes you never really know a body or the functioning arm of a particular body until something happened, right? Because I'm sure you
Yeah.
guys you have been working and doing your work on the grounds and doing behind the scene, and you are not political, as I understand it. You are not
No.
for this political organization, so you are a political party, I mean organization, and because of that, we don't hear your name too much in the news and all of these different things. But because of this particular new report that just came out, of course, now it has become a story to talk about. But I want to go back to that report that came out. I think it was from I got this report here from the New Republic. I
It
believe
was
it was
November 20th.
November 20th. Yeah, yeah. So the news, and basically, again, like most people, we tend to get our information through social media, right? And you log on to Facebook, and they just like, whoa. And what really caught my attention was the way people were downplaying the issue. When I saw it, and someone had posted and said, the next time you go to Calabash, before you enter, you got to show your HIV certificate. So I said, whoa, what is happening in my country? And so then I call some of our friends, and of course they confirm. I got a friend who is a journalist in Liberia. Of course, he confirmed the story to me that he had this report that just came out today showing that 36, approximately, let me say that, approximately 36,000 Liberians are living with HIV. What was your first reaction when you came across this report? Was it surprising to you, or did you already know before it came out?
Yeah, so normally the report of the 36,000 is actually 2024. That, so every year, the UNAIDS, that is the world body for coordinating the AIDS response at the UN. So every year you have experts from Liberia, from the Commission, from the Ministry of Health, from the National AIDS and STI control programs, and sometimes a few of our technical partners join the UNAIDS where they go to review these data. And the data, uh, they review those data based on the performance of the response. So the report you saw come out, it was a report that is done annually. Annually, the UNAIDS releases a spectrum estimates across the globe, and Liberia is no exception. So a team from Liberia leaves and join the rest of the team in sometimes in Johannesburg or Cape Town, South Africa, and they sit there and review these data. So UNAIDS has a modeling software that they call the Spectrum. So the
Okay.
spectrum is, yes, is being used around the world to determine HIV prevalence for the UNAIDS. So every year, experts go to a designated place selected by the UNAIDS to sit there and review these data and uh, work with the software, and the software generate estimates based on inputs. So the report you saw, it was a report for Liberia covering the period 2024. So it's normally released the year following. So this report of 36,000 is for 2024. So the 36,000 that you saw is for 2024. So what the report tells us is that as of 2024, there was an estimated number of 36,000 persons living with HIV in Liberia based on the estimates generated by the UNAIDS. It will interest you to know that the official prevalence for Liberia should be based on our demographic and health survey, the LDHS.
Okay.
But interestingly, The last LDHS that was done in 2013 is the one that we're still quoting today at the rate of 2.1%. The last one that was done sometime around 2018, 2020, they collected the samples for testing, but we understand that it did not include HIV. So currently, we do not have an official prevalence for Liberia. So now we're using the spectrum estimate to come up with our prevalence, which is credible. It's credible. It's no different from the LDHS, but the LDHS is the official for the country. So we're using the spectrum. So the report of 36,000 is as 2024 data, which was released earlier this year, except that on November 20th, there was a press conference called by the Commission to launch the beginning of activities commemorating this year War AIDS Day. And that number was mentioned in a talk to social media. And in fact, the main intent of the press conference was overlooked and the number just went wild.
Yeah.
So
So
that's where we
36.
are.
So 36,000 became that number. So 36,000 was just 36,000. And so, and I mean, your work you do, your work is super important. And so I'm sure when you saw that report, it was one of those things that actually kind of make you feel like, man, I mean, if that was a 2024 report, then we are thinking now, come 2020, I mean, this 2025, we'll get that report in 2026, correct?
Yes.
Okay, so that report comes out in 2026. So if this was a 2024 report, and when you guys receive this report, what are some of the groundwork that you do when it comes to maybe just making sure people kind of talk about this, people understand? I was in Monrovia this no, it was 2024, I believe. And there was a campaign going on there for, I mean, they had, I think monkeypox was kind of sticking around. And so they were having a whole campaign talking about monkeypox and all of those different things. But so I guess the same question I want to kind of bring to you. When you got this report, I know the first thing was like, wow, that number is high because it's an increase from the previous report. What did you guys decide to do to actually go ahead and just do this public service announcement? Maybe took it to school. What were some of your steps that you took or you taking now to actually try to bring awareness to the people?
Okay, so there's two sides to the report. As
Yeah.
much as the number looks bad, it is not. It is actually good in a sense. What do I
Okay.
mean? Yeah. So whenever you find out that the HIV, the number of persons living with HIV in a country seems to be going up, it means
Hmm.
something, right? Number one, it means that we are finding more cases that has been there all along, and it also means that you have more people living with HIV who are alive today. So you see, in the past,
Hmm.
whenever people contracted a disease, sometimes it was even late. So let's go back to how it used to be. In the past, when somebody comes to the hospital, they're already what we call an AIDS patient. They're sick. And at
Yeah.
that time, WHO recommendation was that the person's CD4 count. Now, CD4 cells are cells that make up our immune system. And for a normal and a healthy person, you should have between 900 to 1,005 CD4 cells to be considered healthy. So that is the very cell that HIV attacks. So
Mm.
in the past, when the person is sick, you have to wait for them for the CD4 cell to be 350 before they are placed on treatment. Sometimes they don't recover. So we had a lot of people dying, and then there was this, review of that policy, and then it went to 500. Yet and still, groups of people living with HIV thought that it was not sufficient, that we should get rid of this. Today in Liberia, we're implementing what you call test and treat, meaning that you get tested
Okay.
today for HIV, even if your CD4 cell is 1,000 or 1,005, they put you on treatment immediately. So because of that, we have more people living with HIV that are alive today than in the past. So because of that, you will see the number of persons living with HIV tend to be increasing, but it also means that the treatment program is working for the country, meaning that we're having fewer deaths and more people are staying alive. So for us, when we saw the 36,000, is nothing to, it didn't cause panic. What it showed us is that our treatment program is working. We have more people living with HIV today on treatment. So let's dive into the 36,000, right?
Yeah.
Currently in Liberia, yeah,
Mr. Hinneh, before you go to 36,000, I'd like to ask a quick question just based on what you just said. Now, and look, it is a good news when you say, because for me, I mean, honestly, I've always been one of those guys, right out of high school, I was just like, man, I'm going to go and work for the UN AIDS program, back then, and in Liberia. And basically, I've always been interested in doing some sort of public health awareness kind of program, right? And when you just said that, yes, the number is high, but it is not something that calls for panic at this point in time, because I mean, you are not saying that, we're not worried that people have it, but what you're saying is at least we know that the treatment plan is working and we are catching people with this disease. But does that make it a little bit, no, knowing our brothers and sisters in Liberia, right? When they were talking about helmet, people started putting pot on their head and sitting on a motorcycle. People started making fun of everything. They're not taking it
yeah.
this seriously. So if you say now, hey, you know what? This thing is working. Our plan is working. At least people are living with the disease and they are living longer. Does that make Liberians to take this carelessly and just say, you know what? When I get it, I'll go do my testing, they will treat me and be careless with it?
No, I don't think that's what we're saying. So currently, uh, we have adopted since 2021. Liberia adopted United Nations Triple 95 targets. So that's what we're implementing until 2030. Now, the Triple 95 targets states that 95% of persons living with HIV in Liberia should know that they are living with HIV by 2030. 95%. All right. The second 95 states that of the 95% that know they are living with HIV, 95% should be placed on treatment. And for the 95% placed on treatment, 95% should have a should be virally suppressed. Now, this is what most people don't know. When a person is virally suppressed, that person does not transmit HIV to other people. So let me tell you what is happening. To date, out of the estimated 36,000 persons living with HIV, we've been able to test 31,000 persons.
Okay.
31,000 persons living with HIV. So basically, it's like around 5,000 based on the estimate that we have not tested. Now, of that 31,000 persons that we've tested, we have about 30,700 on treatment.
Okay.
30,700 on treatment. Of the 30,700 that is on treatment, 95% of them are virally suppressed. So let's do the math. 95% of 30,700 persons are not spreading HIV in Liberia. They are virally suppressed. All right, because the treatment that we currently have in country is as advanced as the one you will find in the Western world.
Okay.
And when you start on your treatment, between the day of initiation up to 9 months, you are virally suppressed. When you become virally suppressed, the HIV in your system becomes undetectable. So most of these people here now who have been on treatment for over a year plus, if you do the HIV test, it will show negative, but HIV is there. That's how good the treatment regimen is, and so people are not transmitting HIV. This is why, like I said, for us, we look at the numbers and people tend to panic. Oh, this number, but for us, we see progress. We see that the program is working because we have more people now that are living and are not transmitting HIV to their partners.
Okay, and so when it comes to the treatment, you talk about the advanced treatment that we have in the country, and when it comes to healthcare is one of those areas in the country that we still feel like improvement is needed. We still watch the news, and sometimes we watch the news, and again, though, I'm sorry, because most of the time I sound like every other person who live in the diaspora and they only get that information from social media and they run with it. That's why I didn't want to do it on this particular case, I wanted to talk to someone who is inside, which I'm so grateful you came on. When I mean, healthcare is still lacking in the country. We have seen news report where people are still having babies on sidewalks uh, because they don't have money to go and pay medical bill, whether to JFK or to other private hospitals. How and where are people receiving this advanced treatment for HIV in Liberia, and how much does it cost?
So currently, HIV treatment is available across the country, in all of the counties. There are treatment centers all over the country, and is free of charge. According to the policy, all HIV treatment services are free of charge. They don't pay a cent for it. However, there are some facilities you go to, they require you to register, but nobody is paying for medicine or HIV tests in Liberia. It's free.
Oh wow! So no, I mean this is a very good point you're making, Mr. Hinneh. So the HIV, because I'm I'm telling you, brother, when I was living in Liberia before coming to the States, I had to go do HIV test. I think I remember paying like $150 to do the test. They sent me, the embassy sent me to, I came out a different program. They sent me to a specific hospital or clinic. They wanted me to do that test, and it cost that much, right? And so you are saying now, if people are not afraid, let's say if I walk in the country today, I arrive in Monrovia, and I decided I want to go for testing, I can go to any clinic, I can go to any hospital, and they will do that test for me for free and just pass my information to you if I'm positive for treatment.
Yeah, so they won't pass your information to me. So
Okay.
so when you yeah, so so it's free. HIV services across the country is free, as I mentioned. However, there are some private facilities you go to. They want you to pay, some registration fees and other things. But to do HIV tests, to get the medication is free. It's free. It's being paid for by the Global Fund. So
Okay.
in country it's free. Nobody pays for HIV treatment in the country. So if you walk into a health facility and want to do your test, though you get your test done. If you're positive, they enroll you, initiate you, on treatment immediately. So that's it.
Okay, okay. Well, thank you. And so basically, we're now going back now. And so, those who are just joining us, I just want to make sure that you understand that what Mr. Hinneh is saying here, it is a game changer in my opinion, because there are many people in Liberia who are afraid to go either do the test because they don't know that the service is free, or they just don't want to do it at all. And so the next thing I want to go back to now is. The posts that we have been seeing on social media. The posts that have been going around and people making light of the situation. From your own assessment here, HIV is no longer a death sentence. It used to be like you get HIV and people are just freaking out because it was a death sentence. But advancement have taken place, whether in the West and like you say in Liberia and other parts of Africa, this is actually taking place. But I wanted to talk about the global funding because I know most of the global funding, whether it comes from the World Health Organization, majority of that dollar actually came from the United States, right? And when the United States pulled out of the World Health Organization, our president decided that we are not going to give them the funding anymore, a lot of programs had to be cut back. A lot of different things happen. So, do you find that challenging in your line of work? Did it affect your funding source at all? Are you still getting the same services you were getting before funding got cut? Or do you have some challenges that you're facing now when it comes to funding?
Okay, so for Liberia, thankfully, uh, most of our HIV funding comes from the Global Fund. The Global Fund is based in Geneva, even though we are aware that the U.S. government supports majority of the Global Fund activity. But the Global Fund does most of the HIV funding. We also have PEPFAR funding in country. PEPFAR also contributes to HIV intervention in the country. But most of the PEPFAR funding in Liberia went to intervention for what we call key population. That is for men who have sex with men, female sex workers, people who inject drugs, and transgender. people. So as of now, as we speak now, those services have been cut off, as you mentioned. They've been cut off and currently there's no KP services going on in Liberia. It's been cut off because of the PEFA funding. I think now uh, the PEFA interagencies, those that remain, their intervention mainly is around PrEP, which is the pre-exposure prophylaxis. They're doing it now for breast feeding mothers and breastfeeding mothers, pregnant women, and some other case finding. So yes, so the reduction in funding has impacted programs around the world, including Liberia. Even for the Global Fund, we had to reprioritize the Global Fund a few months ago, and a total of $10 million was reduced from the global funding. So indeed, funding is scarce for HIV. They are still basic in terms of HIV commodity, like the medication, the condoms, those they are still coming in, but we had to cut down. So there's funding constraint. And just last week, the Liberian government and the U.S. government, completed a week-long discussion on the memorandum of understanding of how the U.S. intend to deal with Liberia going forward. And from what we understand, that they will be giving around $9 million annually until 2029, and then after that, U.S. funding towards HIV in the country ends. So
Wow.
that's a discussion about it. Yes. So indeed, it's challenging. It's challenging. We had to make a lot of cuts. We had to suspend some programs. So now we go into what you call integration. But this news is, as much as it was abrupt, it is not new for us because 2 years ago we were, uh, well, how would I put it? Well, I say cautioned by the UNAs, and not just Liberia, but countries around the world, because we had this target of ending AIDS as a public health threat by 2030. So UNAs, having been where they are as per their position, encourage countries to develop what we call a sustainability roadmap, the
Hmm.
National HIV Sustainability Roadmap. And what it states is that the roadmap has to lay out a blueprint of how countries are going to sustain the gains made over the years without or with limited external funding. So for Liberia, we started that process last year. To date, we've completed part A of the roadmap. It has two parts. So it's currently being validated. We're moving into part B. And most of that roadmap is clearly saying that government has to take ownership. And so if you look at this year, what is the theme? Overcoming disruption and transforming the AIDS response. We're actually focusing on that. And in fact, the press conference that brought about this 36,000 was actually meant to raise the awareness, and then in line with 2025, what is the theme to call on government to do more to support the HIV response in the country. So so indeed, this is something that we were looking into, and we're calling on the government, to do more, because our partners and our donors are saying to us that we are drawing down in terms of funding. You have to be responsible for certain things, and even though I do not have the details because I was not part of the meeting, but I understand there was some, during the discussion of the U.S. government, Liberia has to do some things, and then the U.S. government will be doing this. So we will see what the details are later. But yes, funding is scarce, and as a country, we now have to take ownership of our own, health.
Yeah. So right now, though, in your role, are you at all working? Um, I know, like you saying, the government, maybe the government have not taken full ownership or full responsibility of the National AIDS program, but have you received any kind of noise in the background to even feel like maybe the Ministry of Health or other governmental organizations are going to be coming in to partner with you to get this particular thing going? Because this is a public health issue. It is not just the Ebolas and all the other things that we fight about. I mean, this is a public health issue, and it's one of those things. man, for me, when I saw that 36,000, I was just like, man, this is depressing. This is not something that you want to see about your country, you know, because most of us here, like if you know our program here, we talk about Liberia shall rise. So we truly believe Liberia will rise up and meet that full potential. And that is why all the programs we do here, we just talk about things to uplift Liberia, right? And so we are not trying to like see Liberia in a negative way. I want to promote Liberia. Let people come to visit Liberia. Let people come and see, enjoy our food, enjoy our people, and spend time. But this is not a kind of news I want to see. It's a public health thing. Have you heard anything at all that the government might be stepping in to take some sort of ownership of at least to give you, even if it's 25% help that the government of Liberia can do?
Yeah, so I can tell you for sure that since I've been with the commission, uh, we are currently seeing a level of political will that for a very long time we have not seen. The President, His Excellency Joseph Imam Boakai, has taken key interest in the work that we do. And as the chairman on the board of directors for the National AIDS Commission, he has been advocating for us. And indeed, we've had a series of discussions with the government at the Ministry of Health and the Ministry of Finance. You know, the Minister of Health is also a co-chair on our board, and she also the head of the health sector. And in
Mhm.
fact, the Ministry of Health is the one who's actually implementing the HIV activity. We are oversight body. We do not actually implement, but the ministry implements through the National AIDS and STI Control Program, the NACP. So this is something that we're all working together on. The minister is pushing from her end to ensure that services, are continuing our disruption. For instance, when there was a brief pause in U.S. funding, and most of the we have 36 health facilities in Liberia that are being supported through PEFA. When there was a pause and a stop work order, the ministry had to make some, immediate and urgent intervention to make sure that those services that were disrupted were restored and that people, had access to HIV services as before. So this is something that is on the minister's desk, and she's taking keen interest in it. Also, the Ministry of Finance. The Ministry of Finance has also opened up to us. We've been advocating over the years, and we're beginning to see responses from the ministry in that direction. On December 1, the Minister of Finance himself, uh, Minister Kafwan, was at our program. He also again committed the government, willingness to support the HIV response beginning 2026. So indeed, we're beginning to see people coming up now that we know that eventually we have to take ownership. But here's another good news. For a while, the private sector has not been
Mhm.
really involved. Yes, have not been really involved. So the commission has gone out now, and we started to engage the private sector. In May, we had a dinner, a fundraising dinner, and we had a lot of businesses and private individuals coming and giving to that dinner. We also had a private sector engagement a few months ago, and they were all there willing and committed to work along with us once we lead the way. And so that is one sector that we want to tap into, because when you talk about domestic resource mobilization, you have to look inward. And so we
Yeah.
want to use our businesses that we have on ground, including the concession companies, to see how we can have a commitment from them where they can support the national response, in addition to what government will be doing, because government already challenged with competing priorities. We can't say government will do all. So
Yeah.
these private individuals that we're working with, uh, we hope that they will be able to come into support in whatever way they can.
Mr. Hinneh, I think definitely I see the vision. I see your mind. And look, I'm not just blowing smoke. I love visionaries. I love people who come up with ideas and they can see, you know, like some of the things that you're describing, right? In my head, I'm sitting here thinking, look, if each of those representatives that represent their local communities, if each of those representatives can just come aboard and say, look, we know exactly what the National AIDS Commission is doing because this affects our community, the people live in this community. How can we partner with you? And they come in, I believe something good will happen because it will be a whole engagement. Awareness can spread that way too. But the fact that you just mentioned, having these dinners and inviting the private sector to be part of it, that is a very, very good thing, because these same people in the private sector, whether they own companies, they have individuals that work for them. If your workforce is healthy, then of course you have a very happy and productive workforce. And so I like the fact that you guys are actually engaging the private sector as well, because that is exactly what we should do. But not to put you on the spot, not to make anybody from any county to get mad at you, I wanted to ask you, when you look at that report from 2024, you know, which counties are the most impacted? I'm not asking a question so I can run away from that county. No, no, I'm just asking.
No, so first of all, before I forget, the information that was out on social media about communities, Tupo Road and Ibutan, I think it was just for entertainment purposes.
I think so too.
That was not released by the commissioner, nor was it released by the Ministry of Health. So it was just fake information. But let me say to your question, right? So
Yeah.
in Liberia currently we have what we call high burden counties. Now, these counties this is where you find the most people living with HIV and on treatment. So there are three counties among the high burden counties. We have Mosurado, which is the highest. You have Grand Bassa, and you have Mangibi. So these three counties are considered the high burden counties. In these three counties, you find up to 70% of persons living with HIV in these three counties. And then you have next to the high burden counties, you have River G, uh, Grand Gita, and Maryland at the
Mm.
other end. They come next to the high burden counties. Then you have the rest of the counties. So again, that's the answer to your question. So you have Mosurado, Margibi, Grand Bassa bearing the highest burden of HIV, and HIV is an urban disease, so you don't find it in the interior. It's in the city centers, urban areas. So yes,
Wow.
that's yeah.
Wow. Okay. So, I mean, I am not surprised by two of the counties. Honestly, I'm not surprised by two of the counties. I'm not surprised when it comes to Montserrado County, because, look, it is a densely populated city. And then lots of events take place in that place. You guys have this whole thing you're doing in the country called the tidal wave for the Decembrists, and all of these people coming in and out. So a lot of things happening, shaking and baking in the county. I'm not surprised at all. Grandpasa, I was also thinking in my head that maybe Nimba County, because Nimba County is a hot spot now. So I was thinking Nimba County would have been very high on the list, but yeah, it's not like I wanted them. So I don't want people from Nimba County to think I'm saying anything crazy. But I would have thought it was going to be high on the list, since places like Ganta and all of those places are hot spots. People are congregating in those areas. But I can tell you though, I'm really surprised by places like Rebocci and Grand Jita, and the reason I'm surprised by those places, I mean, these Grand Bassa, come on, that's a big. I mean, Buchanan is a big town city. Even during my number day, I grew up in Grand Bassa County, so I know exactly that's a big port city, and so Maryland is a big port city too, and so I'm not surprised there. But the River G and Grand Jita on the list to be part of that, Margibi too, I'm not surprised, because people from Margibi running to Monrovia back and forth. I'm not surprised. But the River G and Grand Jita, I can tell you that I'm surprised. Was there a county on that report that kind of surprised you, like the way it's doing for me at this point in time?
No, I don't think so. If you if you look at River G, you will find out that because of the closeness to the Ivory Coast, River G, Grand
Mhm.
G, yes, that's where you find that could be some of the reasons why you have those counties because you have an influx of Liberians and coming across the border from Ivory Coast.
That
Ivory
makes
Coast
perfect sense.
HIV prevalence higher than ours. Yes, so that's a very good reason. So basically, these are the counties, and so that's where we're focusing. So the HIV response is targeted at these counties, these high burden counties. That's where you find the most intervention
Okay.
in the country.
All right. So let me go back to the report, right? Because when you look at the report, one of the things that was kind of not surprising but shocking in a way was the report indicate that women are mostly impacted than men. And when you look at that, you start to think, maybe I think I understand why. And in my head, I think I understand. But if I was on a committee or on a commission, and these are kind of key indicators that we want to look at. Why are women impacted more than men? I mean, could it be that women are doing the most tests than men? Could it be that women are vulnerable because one man could impact 10 women, based on promiscuity? And I'm not saying Liberia is a promiscuous society, but those are the kind of thing we're going to be looking at to find concrete answer, because once you get those answers, then you can go into intervention mode. So when you look at that report that says women are mostly impacted than men, what was some of the thought process behind it? How could it be? Have you guys thought about it? Or maybe I know the report just came out. Maybe you're still doing some work in that area.
Okay, so for us, we don't wait for the report to come up because we already know what's happening.
Sure.
So as you stated earlier, two factors. One, we know women are vulnerable than men when it comes to HIV and AIDS because of the role that society has given women in Liberia. Women are more vulnerable. Young girls, adolescent girls and young women, they are vulnerable. Uh, and then also because women access services more than men. Yeah, as a matter of fact, yeah, you have more women accessing HIV services than men. We're still having problem in getting men to get tested in Liberia, but the women are always, at the facilities, they're always willing to get tested. So we have more women, recorded than men. So those
Mhm.
two factors, yeah, they are definitely the reason why you have more women being affected by the disease than men currently in Liberia. But the underlying factor is because women are vulnerable and men, all right? Women are subject to sexual and domestic, violence. Women are subject to all kinds of, you know, cultural, downside in our country. And so all of these things make the woman more vulnerable. Young girls are currently unable to negotiate safer sex with their partners. Or you have transactional sex where, because of poverty, you have some older person, with a younger, girl, and he's supporting the family and all of that. In such a relationship, I don't know how you can look at that man and say, use condoms,
Yeah.
and yeah, you're already at a disadvantage end. So because of that, you have more women, just on the downside, and so the disease is being seen in that way.
What are some of the challenges you face when it comes to awareness? I mean, and how are you doing awareness in the first place? Are you doing radio broadcast? Are you having some comedians, actually just highlight the importance of this? I mean, we see those kind of awareness when it comes to election time in the country. You have influencers getting on the radio, or influencers on social media, and doing all of these different things. How is awareness being carried out right now in Liberia when it comes to talking about this public health concern?
Okay, so basically, there are different programs that are being implemented by our partners. Now, we do hear all the time that people don't hear much about HIV awareness. It's true, and there's a reason for that. So, when you have reports like the one we released the other day,
Hmm.
and in our report, it tells you that this particular population is highly impacted with HIV, and that population is highly impacted with HIV, you tend to redirect your focus and now you go to targeted awareness. So over the years, we've been doing targeted awareness at the direct population, that have been affected. For instance, men who have sex with men, female sex workers, transgender. So these people have been targeted with awareness. So there was not much done for the general population because
Mm.
the HIV prevalence in the general population is around 2.1%. You have MSM around 37%. So you want to focus on where the problem is. All right. So we do understand that there's a need to return to the general population. People are calling for more awareness to be created. So normally, what our partners will do is that people go out, into targeted communities, and raise awareness, go into hotspots. So what we do when we're mapping up communities, not to go and post numbers of those infected, but we map up communities because we have identified uh, what we call hotspots in those communities to be places where we find people we're looking for. So we go and raise awareness there. So, for instance, on the 29th of November, we had a team as part of the Voice Day program. There were people going around on the various beaches, in different places, raising awareness, to a targeted group, of people. So awareness have been created by the Ministry of Health, partners in different, locations, targeting specific groups of individuals. All right. So
Yeah.
there are also some awareness, on radio. So for the AIDS Commission, what we've done recently is that we started to engage the media to talk more about HIV and AIDS on the media. So that is something we've done. Our partners, have also done that in rural communities and produce posters. We've put up billboards, a couple of billboards that we have two billboards in rural area. We have some of our partners who have billboard across the country. So that's how we raise the awareness. But we begin to see of late that social media, we need to leverage social media for awareness because we find people there every day, and that's where bulk of the discussion, and that's where most of the misconception and the misinformation, is spread. So beginning next year, we're working on a social media strategy and a program to see how we can be active on social media, raising this awareness and reaching out to people.
And Mr. Hinneh, do you think you are making a difference? I mean, how is the message being received? Because I mean, I can just I can just imagine our brothers and sisters. Maybe if they're on the beach and someone show up and start to talk to them, maybe on a one-on-one basis or on a group basis, or just have a billboard, and they would look at it and they would make light of that because we see the posts on social media, we see the posts, we see the jokes and all of that. And how is the message being received? Do you think you're making a difference?
Yeah, I think so because when we go to those areas to create awareness, people do listen. And we do a lot of testing too because after the awareness, we encourage people to do their HIV test. And a lot of people come up to do their test. Just imagine during the Wednesday, December 1, we're at the Capitol grounds and we have so many persons wanting to do their test there. People just come up to do their test. The message is being received, but social media too is a place where you can be very serious at the same time. You tend to turn that into a joke because you want to stir up, conversation. You want more likes,
You
you
want
want more
views?
followers,
Yeah.
you want views and stuff. Don't mind. I think people know that HIV is real. What people need to know is that there's no cause to fear, getting your HIV test done. And if you know somebody in your community that's HIV positive, there's no need to fear that person. In fact, you should, your attitude towards that person should be positive instead of negative because people living with HIV, they are not the problem in the country. In fact, they are a big part of our solution. Because imagine having tested 31,000 persons from the 36,000, and you have 30 plus thousand on treatment. So 95% of those people on treatment are not spreading HIV. It is our job, as their brothers, their sisters, family members, to make sure that we support them to stay on treatment because the more they stay on treatment, the less HIV infection we have in the country. All right.
Yeah.
So
Yeah.
that's what we need to do to support them, treat them with respect and dignity, and make sure that they continue their treatment in whatever way we can support. We should try to do that because the more they stay on treatment, the less HIV will spread in the country. And so
And
that's what we need.
I mean, I know we're coming to an end here. We got about 4 minutes here to maybe 4 or 5 minutes to end. But how are you tracking those individuals who are infected, who are supposed to be on treatment? How are you keeping track of those individuals? Because look, they can come and get the preliminary testing, and they find out they are positive, and you just tell them like, "Hey, brother or sister, this is not a death sentence. We have this treatment plan to put you on." And I don't know how often you come for a treatment plan. Do you get treated monthly, weekly, every day? I don't know. But how are you tracking these individuals to stay on top of them so they can be part of that 95% that is no longer able to transmit? How are you keeping track of those individuals? Because they could do just one treatment and never come back.
Yeah. Okay, so at the health facility, the Ministry of Health, the NACP, currently when you hear me talk about the sources of our treatment programs because of what we call the differentiated service delivery, DSD. So it's a treatment strategy that those that are eligible, we no longer encourage people to come to the facility every month. You can receive your medication for 3 to 6 months. All right,
Hmm.
because honestly, people living with HIV are not sick. There's no need for them to come to the hospital every month. They are not sick. They live with a virus infection, and the medication is able to suppress that virus infection, and they are healthy, so they don't have to come to the hospital. So the DSD, what it does is that those who are eligible are, they are supplied on a 3 months to 6 months basis. And also we're currently working with 25 pharmacy, private pharmacy in the country, where people can go in their communities and pick up their medication without going to the hospital. All right. So there's a
And when
whole,
Oh, so
yeah,
I'm so
it's a
sorry
whole,
about you. I was just gonna say when they go to those private pharmacy like Lucky Pharmacy or Ita Pharmacy, when they go to those private pharmacy to pick up that medication, they don't have to pay. They just have to show that they're on the
no,
treatment.
yeah, it's 100% free. They don't pay. The medication at those pharmacies were placed there by the government with
Okay.
support from a global fund, and so it's free. So they go there and pick the medication up. So there's a whole system of tracking, of appointment booking, and follow up that is being done by the clinician at the health facilities. And you also have the network of person living with HIV who's also present and also follow up on their peers when it comes to treatment, and then what we call loss to follow up. If a person is supposed to show up for the appointment, maybe by next week Monday, you don't see them, they place a call. If they can reach them, they follow up. So the network of persons living with HIV that we call LibNet, they're also working along with the health facilities to follow up on their peers to make sure that people stay on the treatment.
And thank you so much. And to our viewers, we have been speaking with Mr. Solomon C. Hinneh. Mr. Hinneh is the executive director for the National AIDS Commission in Liberia. And basically, he has been detailing some of the work they have been doing since the report came out. I know most of us in the diaspora, we only hear 36,000, and that's all we carry. We get our information from social media, but he is the guy on the ground, the boots on the ground, hitting each of your community and doing stuff that we are not able to do. Mr. Hina, as we close here, I'd like to ask you, do you think you have enough manpower to evenly be able to be visible in all 15 counties? I know you mentioned earlier that you have six prime locations that you guys are kind of operating from. Do you find yourself mostly focused in Montserrado, or are you reaching out to those other counties equally on a equal basis?
So the HIV response is decentralized. It's in every county. When I talk about the 6 counties, just for the National AIDS Commission, but you
Got it.
have the Ministry of Health, you have the different health facilities, you have our partners across the country working. As it relates to manpower, you have a lot of trained librarians in country, trained clinicians that have been working in the HIV response for years. What is important now is that these people need to be supported. We need money to come in the country so that we can continue to maintain the gains, that we've achieved over the years. But indeed, there's enough manpower across the country. There are a lot of trained, HIV ART clinicians across Liberia who are able to provide the services that people need.
And, and Mr. Hina, I really appreciate. I told you I said it was going to be just 1 hour. I don't want to take more than an hour. So we could do this for a little bit, but I really want the next time I call you, I want you to please answer your phone. So I don't want to keep you for 2 hours. But I'd like to say thank you so much for joining me today, for coming here and clearing some things up. I learned a lot from this program, and I just hope our brothers and sisters also learn. Because look, I can sit here and run my mouth all day, but I know nothing about HIV, how it impact people. And when you talk about that 95% who are no longer able to transmit, that was new thing for me. But I just want to say, ask you here, to our brothers and sisters who are listening, those who may join us later, if they decided that, look, we would love to do something for the work that the commission is doing, is there a funding? They will want to set up a GoFundMe. They will want to do something. Is there a way that they can contribute from the diaspora to say, look, I can't be there to spread awareness, but here's $25, here's $50, here's $10. How do they do that if they were able to do so?
Yeah, so thanks for bringing that up. It's important for us as Liberians to support program back home, especially for those of you in the diaspora. So the commission had what we call a resource mobilization technical working group that was set up. So currently we have a website that we have up, and we're trying to get our website to include a donation, button where people can donate directly to the commission. All right, and see the money and work. It's important because we have those of you in the diaspora, you have family back home, you come home all the time, and it's important to be part of what we do here, and we appreciate a GoFundMe whatsoever, diaspora contribution that you guys can do. We can sit and you can reach out to us. We can sit and discuss how we do this, how we account for money that have been given. I think this notion all the time that people in Liberia just want to eat money is not true. There are a lot of people here who, yeah, a lot of
Yeah,
people who want to see things get done. And
yeah,
this current leadership, especially at the commission, is committed to ensuring that every dime we receive is used for the internal purpose. And
yeah.
just before we go, I mean, though we talk about 36,000, but there's no need for people to be afraid. HIV is not airborne. It's not going to catch you. Once you are in Liberia, and yes, and you protect yourself, you use your condom consistently. For those who are married, remain faithful to your partner. And for those, if you feel you're from a high risk group, we have what you call PrEP, the pre-exposure prophylaxis. You can take it, it is safe, and it prevents you from HIV. So there's no need to worry about HIV because it is not airborne. It is not going to, attack you unknowingly to you once you know how to protect yourself. So there's no need
No one will cough
to
on you,
worry.
and you get it. So-
Exactly. Nobody will touch you and you get HIV. It is not gotten from eating together with somebody who has it, from hugging, just sitting by that person, shaking hands. No. All right. You have to come across a person who is infected with HIV doing unprotected sexual intercourse. And I would just add with somebody who is not on treatment, because when that person is on treatment for a year, the chance is very slim. Or maybe a pregnant woman to her baby, some kind of blood transfusion, that untested blood. So, these are things, but HIV is not easily transmitted. Once you are aware and you protect yourself, there's no need to fear, that, Liberia is infested with HIV, and so you're not coming home for the Christmas. No, come here. Yeah, there's no need to be afraid. But I think it was good having me on the show, and we'll be willing at any time, to come on the show. There are a lot of people at the commission who can come, even from the programs, the NACP, who can take you deeper into the treatment aspect of the response. Because for HIV the response, we have two sides of it. There's a health response, there's a non-health response. Okay, so we can take you deeper into the different types of response and what we do as a country with support from our partners, and we'll be willing to come on the show anytime.
Yeah, Mr. Hinneh, again, I want to say thank you so much. And I am keeping my finger crossed. When our website is up and going, let us know. But in the meantime, I have some good friends. Sometimes, when we have these kind of programs, they will call and say, hey, how can I donate? So until that website is set up, whatever I have, you and I, we have contact information exchange already. You can rest assured that I will be reaching out to you to let you know if I receive $10, $5, whatever I receive, it will be coming to the organization. But thank you for what you do, and thank you for taking your 7 p.m. time to be with me to another hour and say, look, I'm grateful for the work you do, brother, in the country, and I can guarantee you that this is a friendship we establishing. The next time in the country, you can rest assured I'll be calling you, and we'll be definitely sitting there and talking. But in the meantime, man, if you have any last word you want to share, please share it, and then we'll end the broadcast for today.
Yeah, so I just want to thank you for your, invite to this show. I want to thank you and your producers for having us on the show. Uh, like we said, HIV is no longer a death sentence. If you're out there, get tested for HIV. If you're positive, you can be placed on treatment and you can live a healthy life. There's no cause to be afraid. Uh, and so basically, that's it for me for today. I think.
Okay. On that note, friends, those of you joining us, if you have any donation, any contribution you would like to send to the National AIDS Commission in Monrovia, feel free to reach out to us. And you can rest assured that donation will in the right spot. It will go in the hands that we can actually use it to better our community. And to government officials who are listening, this is your time to step up to take care of this public health issue before it goes out of hand. I am grateful for a young person like Solomon and the other members of the commission who are taking that time. This is a love that they actually have. I mean, I don't think these guys are getting millions and millions of dollars, but this is a love thing that they are doing, and I am grateful that someone is on the ground to do these things. Because I remember though, when I was in high school, I don't think we had any of these kind of things around in the country. And so to see that there's a commission dedicated to this, I'm super grateful. And thank you, brother, for what you do. We'll definitely stay in touch. Stay safe. And my regards to your family.
Thank you. You're welcome. Highly appreciate it.
Thank you.